Hello, Mr. Governor. My name is Dr. Dominic Dabrowski. I'm a physician scientist working with Health Partners, the University of Minnesota, and the Minnesota Department of Health. And I'm here to present to you today a concerning new disease that's emerged in the last month within our own borders. It's known as Disease X. And all questions will be answered going forward, and hopefully you'll understand just how serious and rapid of a concern this is. So first, we have to ask the question, what is disease X? And that is a bacterial disease that was recently discovered up in the Mille Lacs region of Minnesota. The first case specifically was found in Onamia by a vacationing hunter, and I'll get into those details a little bit more later. In those past 3 weeks, because again, this was just in mid-April, there have been 6 reported cases, all of which Minnesota Department of Health is aware of. That said, we are only aware of 6 cases. There may have been more since the time that we put this presentation together. Now, disease X was found in several different lakes around the Mille Lacs region. Those lakes are Mille Lacs itself, Pelican Lake, Gull Lake, Upper Whitefish Lake, and Lower Whitefish Lake. Because there are so many lakes in Minnesota, I certainly don't expect you to know offhand which those are, but suffice it to say it's a relatively small geographic area on the scale of about 20 to 30 miles in radius. So we have a pretty good idea of where this disease began. Now, how did these 6 cases come about? Well, they did have some peculiar things in common. Specifically, they were all recreational hunters. These people were hunting not for just any old thing, they happened to be fowl hunting. They were looking for Minnesota loons, and the University of Minnesota Twin Cities campus has already isolated disease X in one of the loons that was found through surveillance after the cases were reported. So we're fairly certain that we found the chicken and the egg in this case. Now, our first case was a 47-year-old hunter who was there on a weekend trip in Onamia, and he tripped and scraped his knee. And in that time, he had been fowl hunting previously and continued to fowl hunt thereafter. We believe the pathogen may have gotten into his bloodstream at that time. So we can more definitively say that there is probably a direct contact transmission. That said, it's not necessarily the only way in which it can be transmitted. 4 of the 6 cases had picked up the loon directly after hunting it. 3 did not wear any personal protective gear or protective gloves, so that lends credence to our previously mentioned hypothesis. However, 2 were simply accompanying hunters. They did not physically pick up the loon themselves, but they were in close proximity. So there is some anecdotal concern that there may be respiratory transmission as well, which is something that we intend to look into going forward. What is disease X? How does it manifest in people? Well, what we found so far in these cases is that they appear to have hemorrhagic symptoms. From what little research has been done at the University of Minnesota, we found that due to surface proteins that I'll discuss shortly, it attacked the red blood cells and the platelets. So far, this appears to only manifest in hematologic or circulatory symptoms. There is a relatively small sample size. Going forward, there could be more to find. Symptoms that have been observed in the admitted patients in the emergency department and in the intensive care unit have been bleeding under the skin, which is known medically as petechia. There has been a few different forms of gastrointestinal bleeding. Those include hematemesis, which is medical speak for vomiting of blood, melena, which is upper gastrointestinal tract bleeding, which was then later found in the stool, and hematochezia, which is bright red bleeding through the rectum, which suggests a lower GI tract bleed. So it suggests that the entire gastrointestinal tract could be affected. Also bleeding into the joints and into nearby soft tissue and muscle. Those are known as hemarthrosis and hematoma. Most concerning was bleeding into the brain. There has been 1 fatality thus far from disease X, and the mechanism of death was a hemorrhagic stroke or bleeding into the brain. I will touch on a little bit in the future why this particular patient was a little more vulnerable potentially than others. But again, things are relatively new and we don't want to definitively say things yet. Now, as far as a sweeping overview of what we know so far, because that is important, there have been 6 cases and 1 fatality in 3 weeks. All 6 cases were originating from the previously mentioned small radius of lakes in central Minnesota where duck hunting is popular. The first case was reported locally in Brainerd. At that time, the patient thankfully has recovered since. I'll touch on a little bit the patient who did not. The next 4 cases were within 75 miles of the lakes mentioned. Most of those cases had returned home from their trips at that time. So the lag time between contact with loons and the presentation of symptoms was several days, ranging on the order of 3 to 5. That's also something to think about when we attempt to establish an incubation period, which so far we have not. We simply have this anecdotal evidence to go off of. The most recent case, unfortunately, was the fatal one reported to Spirit Lake, Iowa, where they were from. They were coming from out of state for their hunting vacation. And they also had the longest lag time, closer to 10 days between their hunting trip and when they actually presented to the emergency department. So there does appear to be an element of time is of the essence. Certainly, the earlier it is caught, the better the prognostics look to be. Having said that, there's a very small sample size, so that's just something we need to keep in mind going forward. That fatal case was admitted through the emergency room, kept in the general ward for about a day, and then transferred to the intensive care unit, where unfortunately they passed away. Their total time in the hospital was a little bit over 3 days. And again, this is just a general characterization when we don't know very much. Now, as mentioned, there has already been some academic work done on trying to isolate this disease. And what we believe is that a similar disease with similar surface proteins that was previously present only in loons, known as disease W, may be the origin source of disease X. We're finding something like 98 to 99% of genetic similarity between disease W and disease X. However, a key surface protein, which we've called Timberwolf 2132, is the likely culprit. On laboratory tests, we found that they do in fact bind to red blood cells and to platelets, which may help explain the previous symptoms that were described in these patients. Timberwolf 2132 does appear to cause disease in both waterfowl and humans. So that is something to keep in mind, that it does appear to be trans species, and those key mutations were likely the reason why. Now, as mentioned, thankfully, CIDRAP has been relatively fast to keep track of these updated mutations and has also been tracking disease W more closely than previously. That said, one of CIDRAP's affiliated laboratories was what discovered disease W back in 2017. That was a little bit further north, only in loons and the boundary waters, but also in the central Minnesota Lakes region, most notably at Mille Lacs as well. In that time, there have been several hundred fatal cases in waterfowl. However, because the target population has been difficult to capture and funding has been relatively scarce, there is relatively little in the literature about how to effectively prevent or treat disease W in loons. Could there have been a prevention of disease X had we been more aggressive in our efforts with disease W? It's certainly tempting to say yes. However, we don't want to feed you a false narrative, Mr. Governor. So that's just something that we would like to consider going forward. However, that's neither here nor there. Now that it appears that there is a method of transmission to humans, the university is taking this seriously, and several government agencies have already been notified about concerns. Now, de-identified medical records and blood samples were sent from Minnesota and Iowa Departments of Health on all 6 patients. CIDRAP has good working relationships with both these public agencies. And we are currently trying to isolate more genetic material, more proteinaceous material, and potentially test it going forward. One of the proudest things that we can say so far about this disease is that we have been able to develop an ELISA assay already. If you are not familiar, an ELISA assay is a diagnostic test which can help isolate the bacteria where it is potentially sourced. Usually this takes much longer. However, probably due to the work with Disease W previously, we had a good idea of how to go forward with that. I'd just like to take this moment to plug One Health for one moment. In an increasingly complicated world with interactions of environment, animal health, and human health, there are commonalities which we can use not only to help our environment and animals, but also people as well. So as these diseases tend to cross previously insurmountable barriers, we can now say that there is something in common, not only in the disease itself, but also in the way it is diagnosed and treated. Having said that, One Health seems to be a good model to keep in mind as we try to discover more about this pathogen and as well as how we try to eradicate it going forward. Um, we think that you should consider certain things, Mr. Governor. We don't want to tell you what to do. However, we base all of our recommendations off of things that have worked previously. We understand that Minnesota, as well as Iowa and Wisconsin, have a rich history of hunting, especially in the warmer months. However, we think that this is a potential public health crisis that could be averted if treated appropriately. An ounce of prevention is worth a pound of cure. We think that waterfowl hunting should be suspended for this spring and summer season, if for no other reason, at least because we do not know enough yet to make more effective measures. We understand that there might be some public outcry about this, which is why we recommend that other forms of hunting, be it for deer, other wildlife, or fishing, should be kept open, fully open, because we don't want resistance from the public, and we certainly don't want to re-traumatize anybody who went through our COVID-19 pandemic feeling socially isolated or socially restricted. So we think those avenues would be wise to keep open. All 6 of our cases, coincidentally or not, seems to have been smokers, specifically at least 10 pack years for each person when we interviewed them on history and physical and present illness. The person who passed away not only had the longest lag time between hunting and being hospitalized, but also smoked the most with approximately 45 pack years. Could these things be correlated? Well, we certainly think they could be. We don't have enough data to say that that is so, but we think erring on the side of caution is not only wise, but carries some precedent. Given the recent coronavirus pandemic, we recommend that certain groups should be advised against being outdoors in areas where waterfowl could be present. Of course, smokers, which we do find some correlation with already, immunocompromised, which are historically more vulnerable to all diseases, as well as the elderly for the same reason, and COVID-19 positive individuals. We think we should extend that to people who are acutely concerned about transmission of disease X once this begins to hit the airwaves, the news cycle, and some rational but also irrational public concern begins to arise. So that is something we're recommending for the Minnesota Department of Health. Because social distancing is still common, we think taking those same sorts of precautions would potentially be wise, certainly for people who are more acutely concerned or more vulnerable. So wearing a mask, keeping your distance from persons, while not necessarily directly beneficial, certainly would not hurt and could be the difference between vulnerable populations receiving the disorder, transmitting the disorder and not transmitting the disorder. Thankfully, the clinical guidelines that have sort of ad hoc been developed by intensivists and emergency medicine physicians so far have seemed to have been fairly effective. Now, triaging and streamlining these suspected cases would be valuable because less time would be wasted. So a high clinical suspicion should be advised for all emergency rooms across the 3 states. and certainly is something that should be advertised to them. What we found is that in 5 of the 6 cases, there are standard measures that have worked relatively well. Fifth and sixth generation and fourth generation cephalosporins, which is a class of antibiotics, have been effective in keeping the disease from getting worse. Intravenous fluids have kept hemodynamic stability, which has led to quicker and more effective recovery. And for those patients who manifest clear, frank bleeding symptoms, such as the hemarthroses and the gastrointestinal bleeding, tranexamic acid, a standard emergency medicine medication for excessive bleeding, has been shown to be effective even in relatively small doses. So as long as we keep that protocol going forward, we think that we can keep things relatively safe, even for those infected. If symptoms don't improve in the first 48 hours, we recommend ICU transfer. Of the 2 patients that made it to the ICU, one recovered fully following a very similar protocol to this. So we're fairly confident that even though we don't know a lot, we at least know how to attack this problem, not in a refined way, but certainly in a broad way that seems to be effective based on our knowledge of pathophysiology and human condition. Going forward, we intend to continue researching both at the university as well as the 2 departments of health. We intend on having weekly conferences at the Twin Cities campus in the Mayo Building, where myself and Dr. Michael Ulsterholm will be having weekly updated press conferences about new information that we find about disease X going forward, and where we can answer any community questions that may be present. This will be open to all media, all public, and we're hoping that it will help quell some of the public outcry that may develop from disease X going forward. Having said all that, we don't think this needs to be a crisis. We think that this can be relatively well contained based off of the information I just shared with you. And we recommend continuing life as normally as possible going forward. We do not think shutting down schools, movie theaters, state parks, or other institutions is worthwhile. We think it would cause more harm than good. So we will continue to monitor this. We fully intend on having our finger on the pulse going forward. And we think that with your support, we can make adjustments and be transparent about it with relative ease. So we think this is potentially a crisis averted because of the lessons that we've learned from coronavirus and previously from other pandemics and epidemics as well. So thank you for your time, and we certainly hope that this has left a positive and informative impact on you. So thank you, Mr. Governor.